How has been a day? Happy Sunday is a good day. So let's wait for people small before I start. Yeah. So let's just wait for like 3 minutes before I start fully. How are we doing? Hope everyone is fine. And how is our health? Hope we're taking our health seriously because health is wealth. Yes. So today, how will be talking about cardiovascular disease. So I'm trying to take time to check to wait for people to join before I will start fully so that I won't be repeating myself. So let's just wait for like 2 minutes. While we are waiting, we can be thinking and jotting what we need to know about cardiovascular disease. Yes. Hope you guys are hearing me very well. So, hi, 50 and beyond. Thank you for joining me. It's good to see you here. Thank you. Hi, Pascal. Welcome. So, like I said, we'll be talking about cardiovascular disease. Yes. So, let's start. So, what is cardiovascular disease? Cardiovascular disease, we call it CVD, cardiovascular disease. A group of disorder that affects the heart and blood vessels. I hope you guys are hearing me very well. Please, if you can hear me very well, just say you are hearing me, please, so that we know that I'm not talking to myself. Hi, everyone. I hope you guys are hearing me. Please try and indicate if you are hearing me clearly. Oh, thank you so much, Michaels. Yeah. So, we are talking about cardiovascular disease. So, cardiovascular disease, let me tell you, okay, thank you so much. So, cardiovascular disease, like I said, they are a group of disorders that affect the heart and the blood vessels. So my outlines, the outlines that I want to be talking about, um, is we have already talked about what is cardiovascular disease. Let me reduce that. Sorry. The most common types of cardiovascular disease, the risk factors of cardiovascular disease, the global relevance of cardiovascular disease, the components, and what are the factors affecting it, the prevention, the management, and also the recommendations. Those are the things that I'll be talking about. So let's talk about most common types of cardiovascular disease. Thank you, Rita, watching from Lagos, Nigeria. Good to see you. You're welcome. Fatima Habas, good to see you. Welcome. Thank you. I really appreciate. So, most common types of cardiovascular disease, um, coronary artery disease, CAD. Coronary artery disease is one of the common type of CVD, cardiovascular disease. It's caused by plaque build up in the coronary artery, leading to heart attack. If you guys know, these days we always heard of the news that someone slump and die, all those things. Those things are caused by mostly caused by cardiovascular disease. They cause heart attack, stroke. So, like I'm saying, in today, I'll be talking about things to know and how to prevent the cardiovascular disease. The effective method, the things to do to prevent cardiovascular disease. Cardiovascular disease is a serious issue, and the statistics are pretty alarming. Nearly, like most times, we do hear that people have stroke, they have heart attack, all cardiovascular disease can lead to death, and over 8,000 deaths per year are being recorded due to this cardiovascular disease, and that is staggering number, and that is too much. And it's better for us to find a way to look into our health. So one of the main reasons of cardiovascular disease is so prevalent is because certain risk factors are too common. High blood pressure. Many people, I work in hospital, and most of the time, like if you want to do some, let's say people that don't want to donate blood, the organization that I'm working, if you want to donate for a person, they will have to check your blood pressure. So, like 80% of those people that they check their blood pressure that is high, they will tell you no, they are not hypertensive. It's not that they are not hypertensive, my dear. Most of them, they don't know at all. Some people think that what they don't know can kill them. That is a lie. What you don't know can kill you. If you don't take care of your health, you were hypertensive, but you are not taking care of it. You're like, oh, if I don't like to go to hospital. I don't have to check it. If I don't check it, it won't affect me. My dear, you are lying. It's better for you to check your blood pressure all the time. Know your status. Know what is going on with your health. So going forward, so like I said, the things that can lead to this cardiovascular disease, they are like blood pressure, high cholesterol. If your cholesterol is, oh please, thank you. You're watching from Abuja. I'm also in Abuja too. Thank you for watching. Welcome. So, like I was saying, so high cholesterol, smoking. People that like smoking, my dear, even the pack of the what they call it, this thing that they smoke now, they always write it that smokers are liable to die early. I don't know why you still want to take it. It's not good for your health. What are you enjoying it for? Why do you want to take it? Smoking can cause cardiovascular disease, which can lead to heart attack and death. So, obesity. Um, all of us know our weight. Africa Fox Day by Seal, welcome. If you are obese, try and work on it. To be obese is not good for your health. Obesity can cause cardiovascular disease, which is not good for your health. So, like I was saying, obesity, lack of exercise are all major contributor to cardiovascular disease. All the scary thing is many people don't even realize they have risk factor until it's too late. That's what I was saying. Those people that just lump and die, they will be like, oh, they are not sick, nothing happened to them, they just lump and died. No, it's because they are not monitoring their health. Assuming they are monitoring their health, Shadows, thank you, welcome. Assuming they are monitoring their health, that's supposed not to happen to them. So you won't know that you have the factor until you check. At least it's good for you to go for checkup. You don't have to be in hospital all the time. Just once in a while, maybe like 3 times in a year, try and go for checkup. It's good to just check your health. Do your vitals like your BP, just check and do some tests too, just for you to know that you are fit, that you are okay. And if you have history of hypertension, maybe someone in your family have blood pressure, my dear, please try and check yourself. It's good. So, for example, high blood pressure is often called a silent killer. That's what I've been saying since. High blood pressure is a silent killer because it doesn't usually cause any symptom until it causes significant damage, like stroke. When someone just can't, you won't, the person, maybe the person can't use one side of the body, maybe one side of the body has already paralyzed due to high blood pressure. So, high cholesterol too is another silent killer that can go undetected at all until it is too late. By the time symptoms appear, the damage has often already been done. So I will be talking more about that cholesterol. You can go to hospital. You don't once you get to hospital, okay, to check your cholesterol, your cholesterol test is lipid profile. You can just walk into any hospital or lab. Tell them you want to check your cholesterol. Okay, thank you. Sorry. Like I said high cholesterol is another silent killer that can go undetected until it is too late. By the time the symptom appears, the damage has already been done. So what I'm saying is that your cholesterol, check your cholesterol level. Go to hospital, tell them you want to check your cholesterol level. It's lipid profile, that is the name of the test to check your cholesterol. Go to hospital, check your cholesterol. If there is any irregularities, meet your general physician to talk to you, to lead you on what to do. So many people think cardiovascular disease are only affects older adults. No. Cardiovascular disease can affect anyone regardless of the age. In fact, many people in 20s and 30s have already developed the risk factors that could lead to cardiovascular disease later in life. But because they are not checking their heads, they won't know. And this is especially true for those that have family history of cardiovascular disease or who has unhealthy lifestyle habits. That unhealthy lifestyle habit consists of smoking. Yes, smoking is not good. I'll keep on saying it. Is not good for your health. Those unhealthy lifestyle consists of obesity. My dear, yeah, you have the what we like call it nature to get big, but you can still try and work on it. Yes, work your health, do exercise, do just eat healthy food. You don't have to eat junks. So try and reduce your weight. So, like I was saying, you are the good news is that by making few simple changes, you can significantly reduce your risk of this developing cardiovascular disease. One of the most effective ways to prevent cardiovascular disease is through healthy diet. Eat healthy. Eating a diet rich in fruits, vegetables, whole grain, and lean protein can help lower blood pressure, cholesterol, and body weight, all of which are major risk of cardiovascular disease. If you are eating healthy, if you are eating diet, it will reduce your cholesterol, it will reduce your blood pressure, and also reduce your weight, your body weight. Exercise is another crucial component of cardiovascular disease prevention. Regular physical activities can help lower blood pressure, improve cholesterol level, and also reduce body weight. And it is not about stress. It is okay. Sorry, something is distracting me. It is not. Gracie, welcome. Thank you for joining my life. I really appreciate you all. So it is not, and it is not about just physical health. Exercise has been shown to reduce stress and anxiety. Exercise reduce stress and anxiety too. Sorry, let me just reduce the someone has helping me with messages. Okay, exercise reduce anxiety too, which are both major contributors to cardiovascular disease. And like I mentioned earlier, regular health screening are also essential for preventing cardiovascular disease. By getting regular checkup, like I've said earlier, and screening, you can identify risk factor early on and able to take steps to address them. Like I said earlier, some people have blood pressure, but they won't know because they don't go to hospital, they don't do checkup, and they will be like, oh, I don't like going to hospital. It's when you go to hospital that they will be seeing what is not in your body. My dear, no. If you have that BP, it is there. It is not going anywhere unless it kills you. And for you to avoid that, go for your regular checkup. So another thing, for example, getting your blood pressure and cholesterol levels checked regularly help you to check any potential problems before they become serious. Like I said, to check your cholesterol level, go to hospital, tell them you want to do lipid profile. Lipid profile is the test for cholesterol level. Welcome, Ernestina. Thank you for joining my life. You're welcome. We are talking about cardiovascular disease prevention. So, like I was saying, that you should check your cholesterol level and also your blood pressure. It will be able to check if there is any potential problem before it becomes serious. And if you do have high blood pressure or cholesterol, it's okay. There are things to do. Your doctor can work with you to develop a plan to get them under control. You can significantly reduce your risk of developing cardiovascular disease. So let me share a story with you. There is someone that I knew, a woman named Sarah, who was overweight. She was overweight and had high blood pressure and cholesterol. She was told by a doctor that she was having high risk of cardiovascular disease, but she insisted on not giving up. But instead of her to give up, she said, no, I can't give up on myself. She started to control her health. She was getting regular health screening. and also exercising and doing diet, like eating healthy, eating balanced diet, and exercise regularly. Within a year, she had lost over 50 pounds, lowered her blood pressure and cholesterol, and reduced her risk of cardiovascular disease by over 80%. If you can do it, you can do it too. Not even only you, you can also tell your relative, your friends and family. Tell them, oh, my sister, let's go for checkup. Let's go to hospital. Just check your blood level, your blood pressure. Check your lipid profile, your cholesterol level. It's good to know that you are healthy. Not to be thinking that, oh, nothing, I'm not feeling a headache, I'm okay, I'm fine. No. Always check your blood pressure and your cholesterol level. So, like I was saying earlier, let's talk about some types of CVD, some types of cardiovascular disease. Like I said, coronary artery disease (CAD) is the most common type of cardiovascular disease. It is caused by peak buildup in coronary arteries, leading to heart attack. Also, heart failure (HF), a condition where the part of heart cannot pump enough blood to meet the body's needs. That is when the heart fails. So, hypertension (HTN), like I was saying, I've said it, that blood pressure is one of the high risk factors that cause CVD, cardiovascular disease. So, high blood pressure. High blood pressure is major risk for cardiovascular disease. When I can't, I would have show you this via pictures here, but maybe later I'll send it to my page for you guys to see. Your blood pressure, the normal blood pressure is less than 130 when the systolic number is when the heart contracts. When your systolic is less than 130, and diastolic should be at least 70 to 80. Diastolic number is when the heart rests. Hypertension affects body. Hypertension can cause depression and anxiety. Hypertension causes heart disease. It causes sexual problem. It causes stroke. Hypertension also causes loss of vision, kidney disease, and also bone loss. You can see many things that hypertension can cause. So, my dear people, like I said, always check your blood pressure. Just know your status. No, it's not bad to have it if you have hypertension. Just work with your doctor so that you can be healthy. If it's to take drugs, to do exercise, or to do any other thing, my dear, just do. Health is wealth. So let's continue. Another one is stroke. Stroke is a condition where the blood supply to the brain is interrupted, either due to blockage or rupture of the blood vessel. I know that many of us have heard of stroke before. Stroke is when like maybe your body now, maybe the one part, maybe like left part in the left hand or left leg, you won't be able to use it for anything, because the brain that is supplying the blood was interrupted and couldn't supply blood to where it's supposed to. So blood clots lodges in cerebral artery, causing a stroke. Well, when blood clots break off and travels, the diseased artery can all this causes stroke. So, like I was saying, this I'm just mentioning the some types, common types of cardiovascular disease. Another one is peripheral artery disease (PAD), narrowing of blood vessel outside the heart and brain. That is the thing we are calling peripheral artery disease. Thank you, Super. Thank you, Opola. Welcome. Thank you for joining me. Also, cardiomyopathy. Yes. Diseases. Learn Yoruba with Stella. You're welcome. Thank you for joining me. Diseases affecting the heart muscles, such as diseases affecting the heart muscles, such as dilated, hypertrophic, and restrictive cardiomyopathy. All these are types of cardiovascular disease. I would try and see if I can share the pictures for you to see how the normal heart looks like. The normal one, the dilated one, and the hypertrophic heart. The hypertrophic cardiomyopathy. How it affects our heart too. So let's continue. So we're still talking about cardiovascular disease. Welcome, Mommy Ramat. You are welcome. Thanks for joining. I really appreciate you all. So we have valvular heart disease. It's disorder that is affecting heart valves. Heart valves. So the disease that is affecting one of this cardiovascular disease, they affect valve. So we call that one valvular heart disease. So it's when the valves are affected. We also have congenital heart disease. The heart defect present at birth. These cases are the children that they give birth with heart disease, congenital heart disease. And we also, the risk factor for heart disease includes, I think I have mentioned some of it. If the people that were here earlier, I mentioned smoking. Like I said, smoking is not good for our health. The pack of the cigarette, I think they normally write it that smokers are liable to die early. Still, people still do it. I don't know why, but I'll keep on saying it. Smoking is not good for our health. Genetics. So now I'm talking about the risk factors again. I'm trying to go through it again for you guys. Genetics. If you have an history of cardiovascular disease, I hope they listen, my dear. Okay, if there is an history of cardiovascular disease in your family, please and please try and go for checkup. Not only for checkup, after going for checkup, do exercise like I said, eat diet, do some tests like check your lipid profile, always check your BP, and just live healthy, please. Health is wealth. Thank you, my sister. Health is wealth. So age too can be age is one of the factors of that can cause cardiovascular disease, and also alcohol. Yes, all those important things. Yes, alcohol. Alcohol also can cause cardiovascular disease. So please, try and reduce your alcohol. I know some people said, okay, alcohol is good for your health too. Okay, I'm not disputing that, but you have to limit it. At least, I think fathers made it to know that drinking alcohol, that is like quantity that you can only take within a day. I think it's like 2 bottles. That is a quantity. Once it's getting more than that quantity, my dear, is no good. Unhealthy food, like I said, junks. When you are eating unhealthy, on anything you see, you eat bones, eat all these carbonated drinks, all unhealthy food. We know food that are not healthy for us. If you don't know, okay, I'll talk about diet later, not today, but we should try. Good. Okay, I'll be talking about the alcohol. I will explain later, but scientifically, it was proven that taking some quantity of alcohol can help you relax your brain, can help you relax, but it must not be too much. I will do another video about that one to explain that, but not today. So today, okay, alcohol is not good, agreed. Let's just focus on the cardiovascular disease that we're talking about. So we should avoid alcohol, we should avoid smoking, and unhealthy food. High cholesterol. If you have high cholesterol, you have risk of having cardiovascular disease. So if it, and you won't even know that you have high cholesterol until you do the test. So that is why I'll go back to check up. You can't be enemies to hospital. Okay, even if you don't want to go to hospital, there are labs that is just lab, it's not hospital, just lab. You walk in, you do your test. Then when your test come out, you know if I'll be talking about ranges of lipid profile later, if time permits me. So after doing your test, if the ranges are okay, or maybe after doing your blood pressure, if you are fine, you don't have to see doctor. But it's when you know that something is not okay, that is when you need to see your general physician concerning your results to help you further. Stress. People that are looking for money is good, but my dear, stress, try and relax. Even if you have all the money in the world, if you don't have health, if you are not healthy, you won't be able to enjoy the money now. So use your sense. Why? Yes, I'm talking about the licensed laboratory. I'm not talking about all this. I'm not talking about chemists. No, I'm talking about standard laboratory. We have many of them around us. They are licensed and standard ones where you can walk in and do your test. So, like I was saying, stress. We should avoid stress. we should try and relax. Like, time to sleep, don't shit your nation. Try and sleep at the time though. When at least a normal woman being supposed to have at least to sleep at least 8 hours out of 24 hours. Then please try, and it's for your health, it's for your own good. If you're not feeling well, how will you spend the morning? So another thing is diabetes. Yes, vital info. Don't worry, that will be from 4:50 to 5 o'clock. I'll be taking question and answer. So anybody that have question, you can ask them, please. So diabetics, like I was saying, diabetes. That is one where checkup comes in again. Know your blood sugar. Even you can even have the machine at home. You can be carrying it all over your glucometer and the glucometer strip. It's easy. Thank God for the era we have now. It's easy. If you are diabetic, even if you're not diabetes, check your blood sugar. Know your status. Know what is happening. And if you have hereditary, you have the in your family, if any of them have that, it was diabetic, my dear, check yourself. Do your blood sugar regularly to know that you are fit, you are okay. And if you notice that you are diabetes, then try and see your general physician. Let them know what to give you and how to keep you on the right track so that it won't affect your health or lead to cardiovascular disease. Okay, obesity. So obesity, if, like I said earlier, eat healthy. If you are eating healthy, it is more likely not to be obese. So you have to eat healthy and do exercise. It will help you with that obesity. When you do exercise all the time, regularly, and you eat healthy, it will be hard for you to be obesity, to get too fat. It's good to look healthy. It's good for your health. Yes, thank you, ma. It's good to have first aid, and one of the first aid kits that you should have at home, like one of my sisters said, is your glucometer and also your BP check. They are the things that you can carry around. It's not heavy. It's a thing that you can do on your own too. So let's continue. So like I said, family history is one of the risk factor of the cardiovascular disease. If you have family history of it, please check yourself. Even if you don't have the family history, still check yourself. It's good to know your status, know your health, know that you are healthy, not to be blind about what's going on around you, about what is going on with you. Also, like I said, let's talk about the challenges. Presently, cardiovascular disease they are common. Even just this week, I was hearing a colleague telling me that a friend's husband slowed and died. Why now? I'm sure that man, the person, is not really care about the health. Assuming is the type that always check his blood pressure, check his health. He would have known that one or two things is wrong. Like I said before, when you have blood pressure, these things won't give you symptoms. You won't know. until one day that maybe the person just have stroke. That is when you know, oh, then it has gotten out of hand. So don't let this thing get out of hand before you go to hospital. Oh, okay, sister, thank you. So don't let these things get out of hand before you check yourself in the hospital. Always go for checkup. It's good. So let's talk about the diagnosis of CVD, cardiovascular disease, the diagnosis. So I'll mention few of the diagnosis. We can diagnose it through blood tests. Blood tests can tell a lot about your heart. They can check stuff like cholesterol level, triglyceride, and blood sugar, which can be sign of heart disease. Some common ones include cardiac troponin test. So like I said I'll be mentioning some few tests that you can carry on to know to avoid cardiovascular disease, like to know your status. So one of it is cardiac troponin test. This one helps diagnose heart attack by detecting a protein called troponin that the heart releases into the bloodstream when it is damaged. I hope you guys understand what I just read now. This cardiac troponin is a test. It helps to diagnose heart attack. Like if you are in danger, like if is the type that check himself or herself. Once you do that cardiac troponin, it gives you an idea. If it's a person that have risk of heart attack before it happens, if you are able to do it before then, it will dictate if there is a protein called troponin released to your bloodstream or not. Another one is lipid profile. I've been mentioning lipid profile since. Lipid profile measures cholesterol levels. Specifically, bad cholesterol, which is low density lipoproteins, can lead to heart disease. Another one is thyroid function test. Listen, parent, thank you, welcome. Thyroid function test. Thyroid function test, it checks your thyroid glands activities. Thyroid issue can affect your heartbeat. I will still talk about some heartbeats when there is irregular heartbeat, like tachycardia, bradycardia too, but I'll get to that. Another one is complete blood count. The complete blood counts looks at different types of blood cell in your system. An abnormal count can mimic heart issue. It can just give you heads up like, oh, something is wrong with you. Then doing that test will help the general physician, the doctor, to know what is really happening with you. Thank you, Shinyeri. You're welcome. So, B-type natriuretic peptide, BNP. It measures protein, we call it pro-BNP. It measures protein called BNP, which increases the heart. Which increases heart and has to work harder, often indicating heart failure. These are the tests that you need to do. If you want more information or if you have any question about it, I'll be happy and glad to take your question very soon. And time is even running fast, so let me quickly go through it. So another test to do is electrocardiogram. That is ECG or EKG. Thank you, ma. So the test check your heart's electrical activities using part of your chest, It's it's painless. This electrocardiogram is not it's painless, and you can do it anytime. It's not like X-ray that's the radio, or what they call it. Okay, it's not like X-ray that has effects. This electrocardiogram doesn't have any effects. It's painless, and it's check your heart beating and how it should be. Also, it will spot irregular heartbeat or any block, damage, or heart failure or heart attack. This electrocardiogram can dictate it. So, exercise stress test. Yes, that is a test called exercise stress test. Ever wonder how well it's? Have you ever wondered how healthy your heart is? This test help your doctor to find out. As you work out, your heart pumps more blood, and if there is any issue with the blood supply, this test with the blood supply in your coronary, this test will give will dictate it. It also guide the health team what type of exercise is right for you. Okay, echocardiogram, ultrasound. Imagine it's like, yes, my dear sister, thank you. It's like a sonogram of your heart. It uses sound wave to create image of your heart, of your heart structure and function. Doctors check your heart wall, movements, pumping strength, valves, and even potential issue like regurgitation, regurgitation or stenosis. Another one is another test is called nuclear cardiac stress test. Myocardial perfusion imaging (MPI). This test uses simple. The name is not even too hard to read. Thank you, my thank you, Mr. Mike. Okay, the test uses image of radioactive. Yes, I was trying to remember radioactive the other time. Thank you. Stop. To show how blood flow through your heart. It is great for checking artery, narrowing damage from heart attack, and the effectiveness of stents or bypass surgery, and even if you need a coronary angiogram. You should be doing this test. Yeah, you can be at rest doing the test. We have different tests that we can do, like also MRI, magnetic resonance imaging, coronary. Thank you so much, blessing. You are welcome. Coronary artery calcium test. This test is known as heart scan. It uses CT scan to spot calcium deposits in your coronary artery. The more calcium, the higher the risk of heart disease, and it helps with decisions like stating the medication or therapy if you need to go for therapy. This test will show what you will need to do. It will give heads up to the doctor what you need on how to treat the patient. Also, chest X-ray is among. We have Otla monitor. This Otla monitor is a device like portable ECG machine. It records your heart activity for 24 to 48 hours or even longer. It is used within heart. It is used when heart symptoms comes and go. So doctor will give you for like you place it on your chest area for 24 or 48 hours to check your heart activities. We also have nuclear imaging tests and so on. So let's I think I have like time is fast. Okay, let's go to laboratory blood test. Like I said, lipid profile, lipid panel, a group of tests measuring the TC, ADL, that's I, HDL, LDL, TG, triglyceride. Fasting lipid profile, it measures the lipid level after the overnight fast. Non-fasting lipid profile measure lipid level without fasting. Direct LDL measure LDL directly rather than calculating it. And also lipoprotein healthy is major type of LDL associated with the cardiovascular risk. So this test, this test that I quickly mentioned. Sorry, I'm trying to rush to make up to time. Thank you. I just have some minutes left before I end this live. So this test helps to diagnose and monitor lipid-related cardiovascular disease, enabling health provider to develop effective treatment plan. Key components. The laboratory diagnosis of lipid profile in cardiovascular disease involve measuring the level of different types of lipid. Lipid means fats in the blood. Here are the key components. So, thank you, sister. So, total cholesterol, TC, like I mentioned the other time, it's total cholesterol. It's measured the sum of all cholesterol in your blood. We also have low density lipoprotein, LDL cholesterol. It measures the bad cholesterol that can lead to plaque buildup in arteries. And also high density lipoprotein, that's HDL cholesterol. It measures good cholesterol that can help to remove excess cholesterol from the bloodstream. Triglyceride, TG. That one, it measures the level of triglyceride, a type of fat found in the blood. Also, very low density lipoprotein, VLDL cholesterol. It measures the level of very low density lipoprotein, and a type lipoprotein is a type of bad cholesterol, so it measures it in your body. Lipid profile ratio, it calculates ratios such as the TC, that is total cholesterol, the HDL, high density cholesterol, and also the LDL. Thank you, welcome. And also the LDL, and help assess cardiovascular risk. So like the lipid profile, the test. Let's talk about the 5 tests of in a lipid panel. They are total cholesterol, like I mentioned, total cholesterol, low density very low density lipoprotein, triglyceride, and high density lipoprotein. So also let's talk about okay, I said I'll talk about the reference range. Time is really going. If we check our cholesterol, how the reference range, the normal range, the borderline. Okay, let me quickly go through it. So total cholesterol, the reference range is 200 milligram, while the borderline is 200 milligram to 239, and above 240 milligram is higher. Okay, let's go to what is considered a normal range. Yeah, if person cholesterol level are either too high, if a cholesterol levels are either too high or too low, that may be a higher risk of developing heart disease or stroke. The doctor would consider the factor as the patient's weight, the level of physical, thank you so much, the level of physical activities, and family history when assessing the risk. If the tests are abnormal, the doctor may also prescribe a blood glucose test to screen for diabetes. Therefore, to assess one risk of developing heart disease, a cholesterol test can measure the level of cholesterol and lipids in the blood. It is recommended that healthy adults should have their cholesterol level evaluated at least once every 5 years. That means if you are not risk of like this every 5 years is not for people that have the hereditary disease or that have it in their that like they have it in their family. This once in 5 years is for people that they don't have the risk at all. They are not obesity, like they are really healthy. Even if you are still healthy, you still have to check your cholesterol level. However, individual with a family history of high cholesterol and those at an elevated risk of developing heart disease should have their cholesterol level assessed more frequently. Like I said, thank you. So, what are the factors affecting the lipid profile level? Like I mentioned earlier, eating habits can significantly change your lipid profile level. Some drugs too are expected to change your lipid profile level. So, prevention of cardiovascular disease. Let me go through it again. Healthy diet, regular exercise, stress management, quit smoking, monitoring and controlling your blood pressure and cholesterol, managing diabetes, getting enough sleep. Sleep very well at night, please. At least 8 hours is good and healthy. Healthy lifestyle and behavior. Your nutrition, oh God. Encourage a gradual increase and intake of vegetables, fruits, and whole grain to meet dietary guidelines. Limit consumption of saturated fats, added sugars, sodium, and processed food. Smoking. Utilize behavioral change, intervene, and pharmacotherapy. That means if you are a smoker and you can't stop it, my dear, ask for help. Obesity. Assess risks and counsel on strategy to prevent, manage, and improve obesity and type 2 diabetes. Sorry, my network just went off. Okay. So sorry, my network that just went off. Sorry about that. So exercise you exercise regularly. You sleep, yes, for adults, like I said, 7 to 8 hours of sleep at night. Yes, that is the LD one. Please screen for sleep apnea if in those with established risk factors. Gifts God doing, yes, like I said though, that is the best thing. 7 to 8 hours, that is the normal hours to sleep. Thank you. Conclusion. So the prevalence of heart disease in Nigeria is a cause for concern. The surging number indicates, thank you, indicates a substantial burden of modifiable cardiovascular disease risk factor among Nigerian adults, highlighting the need of for increased awareness, diagnosis, management, and of those conditions to prevent future cardiovascular complications. So, recommendation: early detection and treatment can help prevent cardiovascular disease and reduce risk factors of complications. Beware, when it comes to your heart, there is no time to waste. If you have symptoms If you have a symptom of a heart condition, don't wait. Seek medical help promptly. The first step is seeing a doctor. Then they can give the right test and address any issue. But that is not all you can do. Stay proactive with health work and exercise, diagnostic activities. It helps you to keep track of your heart performance. So you are always in the know about how your heart health is. Your health well-being is top priority. Take charge of it today for healthier future. Get started by doing regular checkup. Proverbs 4 chapter 23 says, above all else, guide your heart, for everything you do flows from it. Yes. Thank you so much for listening. Okay, I said I would mention about the heartbeat. Tachycardia is a fast heartbeat when your heart is beating so fast. The heart rate when the heart rate is greater than 100 beats per minute, while bradycardia is when the heart is slow. When there is a slow heartbeat. When the heart rate is less than 60 beats per minute. Normal heart rate is 60 beats per minute to 100 beats per minute. Thank you so much for listening. I really appreciate. Thank you for joining me. If there is any question, I will gladly answer your question in comment section. Just send in your comments. Anything you want to ask, you can ask me from there. I'll gladly answer everything. Thank you all for joining me. It's nice talking to you all. I really appreciate. And God bless every one of you. Please take your time. Thank you so much. Thank you. I only have 1 hour and which is already elapsed. So I don't want to go beyond that 1 hour for now. I will do more live later to talk more. But like I said, if you have any question, you can ask. I'll be waiting at the comment section. So I will answer anyone that asks question at the comment section. Thank you so much for everything, and thank you for joining my live video. I really appreciate. Thank you. I really appreciate. I appreciate everyone. Thank you. Yes, knowledge is wealth. We should always try and take our health serious. Yeah, so like I said, exercise all the time. The lifestyle modification, we should just try and do what is best for us, and God will be with every one of us. Thank you. So I'll be heading I will have to put a stop to the live now. Like I said, if you have anything to ask me, I'll be waiting at the comment section to reply everybody. And I appreciate everybody. And yeah, we have to be here so that we can take care of people that are not feeling well. Thank you so much. It's a blessing. I really appreciate. We are doing God's work here too. So it's God's work saving people's life. That is our goal. Thank you so much. Thank you all. I really appreciate. Emmy, thank you. I appreciate you too. James Store, thank you. I appreciate you. Bye. See you in my next video. In my next live video, yeah, soon. Thank you so much. God bless you. Bye.